information on prevention, tools for a healthy lifestyle. Make little changes to be the best you. It's all here. A podcast empowering, informing, and motivating Bermuda to live well. Bermuda Health-Abets. Everything from A to Z on healthy living. Brought to you by the Health Promotion and Wellness Office of the Department of Health in collaboration with local health partners.
Welcome to an episode of Bermuda Health-Abets, a podcast where we discuss everything from A to Z on healthy living with a mission of empowering, informing, motivating Bermuda residents. I'm your host, Simone Hollis, public health nutritionist, and our guest today is Nicole Harvey from Bermuda Hospitals Board to discuss Baby-Friendly Hospital Initiative. Please share a little bit about yourself and your role.
Good morning, everybody. My name is Nicole Harvey. I am the clinical manager for our maternity ward and our special care baby unit, and I am also part of our breastfeeding committee, and I am in charge of spearheading the Baby-Friendly Hospital Initiative, which we are starting at the hospital.
Okay, excellent. A lot of experience there being in the maternity ward and also helping and assisting with breastfeeding mothers. So we know that we're looking at the Baby-Friendly Hospital Initiative. Can you tell us what it actually is? Like, what does it mean for Bermuda Hospitals Board to focus on that?
So the Baby-Friendly Hospital Initiative, it is a global movement, and it is spearheaded by the WHO and UNICEF. And the overall aim is to give every baby, the best start in life by creating a healthcare environment where breastfeeding is the norm.
And I think that's so important when we start talking about breastfeeding being normal. If it could be normalized within Bermuda and the culture, and how important that would be for the benefits that it often provides for those mothers who choose to do so. And so how is Bermuda Hospital Maternity Ward trying to designate themselves as a breastfeeding friendly hospital? Because this is also part of what's happening worldwide when it comes to WHO and how they do things, and why it would be important for Bermuda to follow suit in order to ensure that we give that safe environment for those mothers choosing to breastfeed, and to ensure that you follow all the guidance and the rules for those who are part of WHO.
So the Bermuda Hospitals Board, Maternity Ward, we have started a baby-friendly hospital initiative committee where we are meeting monthly along with stakeholders from Gosling Ward, Department of Health, to come together to get this baby-friendly hospital initiative going. We will aim to apply the principles in the joint state to be designated baby-friendly to call public attention to the support for a sound environment where moms can feel comfortable breastfeeding in the hospital and when they get into the community.
And so this is really important for mothers. You know, this is a special time when it comes to especially new mothers. You get other mothers who have probably had other births, and so they know what to expect with breastfeeding. And so trying to support that is really important so that they have an opportunity for all the nurses who were there once they've actually given birth, to help them to get a good latch, to help them be supportive without any other interruptions from any other types of things that might cause some issues to prevent mom being as successful as she may want to do the breastfeeding. Is that correct when we're talking about how we can create a better environment with all the other issues that would be involved, or other things of formula or bottles or all those types of things.
Yeah.
That's going to have a big impact with regards to how you guys help and assist and do things and what might be provided unless it's medically necessary, I would presume.
And that will also include the formal education for all the nurses, so that all nurses will be saying the same things to patients and giving the same breastfeeding care to patients, so that we can help them all to be successful.
Yeah, because sometimes you get that confusion, if they've heard it from their physician, if they've heard it from another nurse, and sometimes people come with different ideas and thoughts, but if we can have it all in that same sound environment where everyone's saying the same thing and the correct information that we want to move forward, we could really make this the norm and set women up for that success that they need at the very beginning, to breastfeed. There's always going to be some different challenges and things like that, but at least when we get the first start, and they get that support and the focused, and letting them know that you nurses at the hospital are there to help and try to do the best for what's needed for the healthy, normal babies that are able to breastfeed effectively. So what are the goals of the Baby Friendly Hospital Initiative?
So one of the goals is to transform hospitals and maternity facilities, which would be our hospital, to transform it through implementation of the 10 steps. The second goal, and the practice of distribution of free and low-cost supplies of breast milk substitutes to maternity wards or our maternity ward. BFHI, which is the abbreviation for Baby Friendly Hospital Initiative, was incorporated the International Code of Marketing of Breast Milk Substitutes in 1981 and is aimed to protect and promote breastfeeding. More than 20,000 hospitals in 156 countries in the world have launched this initiative and adopted it over the last 15 years.
Well, 20,000 hospitals across 156 countries. And so now we're just getting on board to something that's been going on since quite some time, of where they've tried to create this. Last 15 years, actually.
Yes.
Really important. And so what people don't realize is that when we talk about the code of marketing of breast milk substitutes, people don't realize how much it's already ingrained when they see it on television. In our culture, we don't see women regularly breastfeeding. Not saying that they're not doing it. I don't think in personal opinion, I don't think there is enough women actually doing it. And so we don't want any side of that. We don't want any outside influences from any of those companies that are going to be offering the formulas or giving mothers formulas to take home. That's not going to be our role. Our role is going to be making sure that we can promote breastfeeding, specifically for those mothers who have that desire to do so. Medically necessary, like I'll say again, it will occur because the hospital is a place sometimes for those who are unwell. And so, but we're talking about for the normal and regular births that occur and how we can support them. So I think that's really good. And for us getting on board with that, part of this podcast was just to share with the rest of the population, this is what's happening.
Yes.
And some of the changes that are going to occur and the things that you won't see. So that it doesn't become one of those things that, you feel that the hospital should, the hospital could, why don't they? This is what we're trying to do. There are 20,000 hospitals in 156 countries, like we said, who are following the Baby Friendly Hospital Initiative. I remember when we had COVID and you couldn't get the formula. Now, if you only breastfed, if women breastfed, they would have had that access. And formula is extremely expensive. And we also live on the island knowing that we could be 2 weeks short of food supplies, any food supplies, if we don't get ship seeing. And it may seem far-fetched, but we weren't too far from it when it was COVID, right? And babies got to eat. And it's natural for mothers to breastfeed. We just would like to support those who, and I'm speaking on behalf of the breastfeeding committee. We like to support those mothers who choose to ensure that they have that safe environment. And it's going to start in the hospital. It can't start anywhere else, right? Because that's their first contact. They have that opportunity to be with their baby and those different types of things. So when it comes to the Baby Friendly Hospital Initiative, I know I'm working with you as the Department of Health, and probably even the representative to contact WHO, find out how far we are, and PAHO, how far we are on the initiative. But there are steps. And there's a lot of steps. And it's going to be a process. Everything's a process. This podcast, like I said, is just for awareness, so you know the process that will be coming into play. So can you just describe some of the 10 steps that the Baby Friendly Hospital Initiative is encouraging, the hospital to do so that they can be designated as a baby-friendly hospital?
So the first step that we're working on as a Baby Friendly Hospital Initiative committee is that we have to have a written breastfeeding policy that is routinely communicated to all healthcare staff. So I am spearheading that part where we're updating our breastfeeding policy to include the 10 steps as well as any addendums from Department of Health visitors. Will have a section in there for their part that they do in the community. So that's the first step that we're working on. And then the second step, which is very important, which I mentioned already, is training all healthcare staff in skill necessary to implement this policy. So that would mean retraining the nurses to have the frame of mind where we're accepting breastfeeding and we're not willingly giving out formula anymore or breast milk substitutes anymore, to try everything in your power to get moms to breastfeed.
And Nicole, I'm going to say, you said to train the nurses. But it's more than just the nurses.
Right.
Because every single person in the hospital has some type of contact, whether it's the porter, whether it's the cleaner, whether it's, and this is it's a very special time, but it could be a stressful time. And sometimes some people want to give that information and support if they see it. So now when we do this staff training, we know that everybody's going to be supporting mother with the same information that's going to provide her with the confidence that she needs and letting her know she's doing it correctly, to let her know it's okay, so that she feels supported to continue and to try, as opposed to saying, don't worry about that. It's not a big deal. Just, some mothers really want to breastfeed, and I feel that they need to be supported to do so without feeling like, I can't do this.
Exactly.
It's doable. It's just the patience. It's the time, and being prepared, and then having that support, that sound environment that allows for it to occur naturally.
Yes.
So
talking about staff, the hospital, BHB, I believe, has over 1,800 staff.
Yeah,
so
that's a lot.
That includes the housekeeping, like you said, IT department, dietary. Everybody that is in the hospital would need to have some knowledge of Baby Friendly Hospital Initiative.
Yes. Okay, so some of the others?
So the third step is to inform all pregnant women about the benefits and management of breastfeeding, and that will start probably in the community, because now the health visitors are doing their antenatal visits with the mom, so it will probably start there and in the doctor's offices, with them hearing their first knowledge about breastfeeding, the benefits and management of breastfeeding, and also moms go to prenatal classes and stuff in the community as well, so they'll hear about it there. And then of course when they come into the hospital, it will continue, where we will help them to manage the breastfeeding.
But even this is where the continuity of care is consistent, right? So when we have this baby friendly hospital initiative and all of those things, they might have did the courses before they came in for labor, but when they go out, we have our health visitors who still help and support to ensure that they can support mothers even further. So it's all that continuity of care that is really helpful to ensure that once again it's successful.
Yes.
You know, because I really would like to see breastfeeding normalized.
Yes.
It shouldn't be frowned upon if women are going into restaurants or whatever and breastfeeding and, you know, feeling uncomfortable. It's a challenge, but we need to definitely to start here. Yeah. I just want to put that point out.
Yes.
So what's some of the others? We got like 10 steps there.
So, also, important one, well, they're all important, but a very important one is that the mother should be able to initiate breastfeeding within half hour of birth, of delivering. So this would be whether they have a regular delivery or a C-section. So this would be a big task for us to accomplish in the hospital right now because we do have some challenges.
Okay. But this is a process. We're still working on the steps. But I understand, and you did say, but I'm surprised that's within a half an hour. Is that
in a half an hour,
normally what occurs, in a half an hour? I know when I had my baby, as soon as it was out.
Normally, if it's a regular vaginal delivery, that baby is on that mom's chest. It never leaves the mom's side. But the issue we have right now is our C-sections. Sometimes we're having C-sections over in the acute care wing, so mom and baby are getting separated. So that would be something we would need to work on.
Yeah, definitely to work on so that we can abide by the guidance that's required in order to be baby friendly hospital. So and to get that status. So that's one thing that we're working on, and it's not even to say, because it says within a half hour, so it's not to say that it doesn't happen. We just need the consistency for it to happen on a regular basis. So what other steps? So we're on step 4.
So once mom delivers, it will be for our nurses to show mothers how to breastfeed and how to maintain their lactation even if they should be separated from their infants. So this will be babies that end up in our special care baby unit. Sometimes we have our preemies. Sometimes we do have normal newborns who do end up sick and up going into the special care baby unit. So that's where we help moms to express their breast milk, and we store it and give it to the baby when the baby is well enough to receive it from them.
Oh, okay. That's a good thing, because I know some women think that it's actually good to breastfeed ahead of time. Isn't there a risk with that?
There is a risk, but you can do it. Apparently there is a movement right now where you can pump, I think, for up to 5 minutes just to get a little bit of milk before you deliver to give the baby. But you should not do it excessively because it could induce labor. Yeah.
But that's not what we want to promote, not with that movement, right?
Right.
Because the only way the baby's going to get that. Now, I know we talked about it before, that when we had our infants who were unwell, you still didn't offer a bottle. They were giving it in a cup.
Yes. Yeah.
So, I mean, and then you run the risk of different sterile situations and different things like that. Definitely from putting it in a cup, and it's not the best.
No,
it's probably not my specialty to say, but I know that there are some risks with regards to that.
Yes.
But the best and ideal would be to offer it in a cup, which may sound very strange, because when I heard it from some of your nurses we had our meeting, I'm like, in a cup?
Yeah.
Just so that you're not providing that bottle. Yeah. And that was some of the infants that were ill, or mothers were very ill, etc., and how they may have to have it. Okay, so what's number 6?
We should be give newborns no food or drink other than breast milk unless medically indicated. So our babies that are in the special care baby unit, we definitely try our hardest to get moms to pump their breast milk, and we store it in the fridge, or if they can't have it right away, it goes in the freezer. We usually don't give any other sugars or anything to them anymore. We don't do any sugar feeds or anything like that. If a baby needs anything for blood sugars, it will go through a vein in an IV.
Okay.
So we avoid any other food or drink. They don't get any water or anything like that in the hospital. Just the breast milk. If mom cannot make any breast milk, because there are moms who have had surgeries of the breast and things, sometimes they cannot produce.
Okay.
So they would have to be given a breast milk substitute.
But with this baby-friendly hospital initiative, if it's not, would that be considered medically necessary? I mean, I know with regards, that'll be on the infant's side.
Right.
That it gets the formula. But will you guys be providing it when we talk about the code of marketing? Like,
right.
if when we follow the baby-friendly
yeah.
hospital initiative, we're not providing that because of it's not, air quote, medically necessary. It's necessary for baby to feed.
Right.
But what does that look like?
So
What would that look like for that mother and that infant?
medically,
at that
well,
time?
if the mom knows ahead of time that she is going to have a problem producing breast milk, she can bring her breast milk substitute in to the hospital with her.
And that includes bottles,
That includes
nipples.
whatever bottles, nipples she wants to bring with her. But our preemies in the special care baby unit now, we will have formula in the special care baby unit, because we do sometimes have babies that either the mom, like you said, is totally sick. Sometimes you get moms that are up in the intensive care unit and they can't do anything. They can't even pump. So these babies would have to get formula until the mom is well enough to pump and give the breast milk.
So I just want to make sure that everyone understands the clarification between that of being medically necessary,
Right.
or even having a choice of choosing just not to. Not to would be different, where you mentioned to abide by the baby-friendly hospital initiative. Those mothers would need to bring their own, and it will not be provided.
Right.
Yeah.
Yes.
Okay. So 7.
So practicing rooming in allows mothers and newborn to remain together 24 hours a day. Like I said earlier, we do have a challenge with that because of the way our C-sections are happening right now. They don't get to be with mom the full 24 hours for the first day, but after the first 24 hours, they're usually in with mom for the rest of the time and are not separated from her.
And that's really important. I know some women, it's been such a long time since I gave birth. Oh my gosh. But that rooming in, like, people need to realize it starts immediately when it can.
Yes.
And rooming in is where it's necessary, where you that baby needs to start that bonding outside of the womb.
Yes.
And I don't know if fathers are able to come or whatever the case may be, or
the
stay,
dads
or
are
whatever
allowed
the
to
case.
stay over now. They're
And
allowed
so-
to stay.
Right, so that 24 hours is a good way to gauge what it's going to be like. The nurses are there to assist and have questions, but nobody's taking baby unless medically necessary to a separate room to be formula fed. That's the
Right.
real issue of recognizing that this rooming in is going to be important for you to bond,
Yes.
to know what it's like. But to have that professional assistance there, because when you leave and go home, which is like what, in 3 days,
3
2
days,
days,
yeah.
3 days,
2 to 3 days.
Yes, it's not that long. It's not a break. It's the start of motherhood.
Exactly.
Yeah, so that's a good thing, that unlimited contact. And so during those 3 days, they will have the support of those trained staff and the nurses that can help them to assist with the latching on, which will be important. Yeah.
Yes.
Okay.
So number 8 is encouraging breastfeeding on delivery. And when you encourage breastfeeding immediately, like we said, within that half an hour, it encourages the earlier passage of meconium, which is the first stool of the baby. It gets the first stool out quicker. It lowers the maximal weight loss. Your breast milk can get established sooner, the quicker you get the breastfeeding going, and a larger volume of milk intake on day 3, and also it can decrease the incidence of jaundice.
Okay. So it's really important within that half an hour to get those infants on the breast. It's so how important. And so these are the reasons why we need to support those things, which is really important. What about number 9?
So you just mentioned giving no artificial teats or pacifiers. And that would be only if the mom brings them in herself. We are not allowed to provide any artificial teats or pacifiers because we want to be encouraging the breastfeeding.
And this brings down to the other thing we discussed, where we talked about they're not staff, but there are some gifts that are given out sometimes. So we're going to even ensure that those specific items are not in the
Yes.
And so what it is, it's about consistency, clarity, and continuity of care for everyone to be saying and having that same conversation with mothers.
Yes.
And number 10?
Number 10, the last one, is to coordinate discharge so that parents and their infants have timely access to ongoing support and care, which is what we mentioned already.
Yes.
Every mom and baby that is discharged will get a visit from our health visitors in the community to encourage that ongoing support of breastfeeding.
Right, and they and even if there's any issues, they can contact them sooner. Most times they get to them. I'm not sure. I might be misquoting. I think it might be
within 2 weeks.
Within 2 weeks.
Yeah.
Yes.
But now with them doing the antenatal visits, they're already establishing a relationship with them before they deliver.
Excellent.
So they will have their contact information way ahead of time.
So we'll have that. We'll have that.
Yes.
That discussion already. Yeah. So I can see that we're really aiming to provide a safe and adequate nutrition for our infants. As a dietitian, that's so important. People don't realize the importance of breastfeeding with warding off non-communicable diseases, overweight, obesity, diabetes, all of those different types of things that are really important. The immunity that they get from the mother, if the mother's been immunized over specific diseases, babies get some of those things as well, the antibodies. We want to protect and we want to promote breastfeeding. We want to ensure the proper use of breast milk substitutes to be used when it's necessary, and not to just be used because I don't, I just choose. Well, I shouldn't say that, because if people choose not to, they choose not to.
Right,
they just need to understand that
opinion.
That's going to be your responsibility to do so.
Yeah.
So I'm so looking forward to us becoming a baby-friendly hospital and taking on that initiative to ensure that we can provide that safe environment for our mothers.
Yes.
Do you have any other last words that you want to share?
Same as you. Very excited to get this going finally, because we did attempt to get this going a few years ago, and unfortunately it was before COVID, and then COVID came and things got delayed even further. But now it's very exciting that we can hopefully get this initiative going and have it up and running hopefully in the next couple of years, hopefully.
Yeah, normalize
the breastfeeding. Yes.
Everyone support breastfeeding mothers. It's a special time, but it requires a lot of patience on both parties, on all partners, on all supports.
Yes.
So we need a culture that does that and can be more open to it. So thank you for attending and willing to share what the hospital is moving forward with. And we hope that you can come back and speak again.
Sure.
So, thank you for listening to another episode of Health-Abets, where we discuss everything from A to Z on healthy living. Continue to follow us on our Department of Health Facebook page for our next episode, as well as our YouTube channel. Thank you.
You have been listening to Bermuda Health-Abets. Please note, anything you heard on this podcast is not a substitute for visiting your healthcare provider. If you have a topic or want a question answered, please contact the Health Promotion and Wellness Office of the Department of Health by emailing healthpromotion@gov.bm or by calling 278-4900. Be sure to listen out for the next episode of Bermuda Health-Abets.